very much, Speaker. My questions to the Minister of Health and Long-Term Care. A little jeopardy for the Speaker, or for the Minister, Speaker. This hospital's emergency department had the busiest month in its 143-year history in January 2018. For this past year, this hospital has been over capacity, and since December, this occupancy rate has been over 108%. Mr. Speaker, this story isn't nothing new. The dire straits of Ontario hospitals are facing today are not rare or even occasional occurrence in the province anymore. It's happening across the riding in Elgin, Middlesex, London, in Sudbury, Hamilton, and Ottawa. In fact, Mr. Speaker, I'd have an easier time telling the minister where the hospitals that aren't chronically overfunded or overcrowded. Excuse me, Speaker. Based on the challenges I've described to you and the questions that I've posed, could the minister tell me which overcrowded Ontario hospital I'm speaking about?
Minister of Long-Term Care.
Thank you very much, Mr. Speaker, and I do want to say to the member opposite that we have a very comprehensive system of health care in this province. It includes some 144, I believe, hospitals, 143 perhaps. There have been some amalgamations. But of course that's not all. We have so many ancillary community support services, and we're committed to looking regionally at the needs. We know that the demographics in this province do vary considerably. This is why our government established local health integration networks, so that we have that local input to ensure that we have individuals. Obviously everyone knows LHINs are governed by a board. They have divisions looking and analysing constantly at the needs of their communities. And so we respond as the ministry to what we hear from the ground, and we do our very best to accommodate those needs in a thoughtful, analytic way. We will continue to make this progress that we have made very substantially over the course of our government.
Thank you. Supplementary.
Thank you, Speaker. Back to the minister. Speaker, what we've seen over the past 15 years is this government invest in large bureaucracies and administration. We've seen them form the CCACs into 39 cents of every dollar go into administration. We've seen the Ministry of Health expand from 5 deputy ministers, assistant deputy ministers, to over 20 with a full complement of staff. What we've seen, though, is a cut in frontline services and overcrowding in our hospitals. The situation I described previously is the sick kids just down the street, a world-renowned children's hospital conducting cutting-edge research and providing innovative, life-saving care. But it's busting at the seams. Children in critical care are having to squeeze in a room with 5 other patients, and their families sometimes have to be there in the most stressful and scary times of their lives. Speaker, this government should have seen this coming. It's not because it's a one-off year. It's years of underfunding, despite warnings from sick kids and other hospitals in the province. So will the minister finally listen and commit to fully funding our hospitals in this upcoming budget?
Thank you. Minister.
Mr. Speaker, any suggestion that the Ministry of Health and Long-Term Care is a bloated bureaucracy is a complete myth. In the past 13 years, the Health Ministry budget has almost doubled, increasing from about $30 billion to $52 billion, while administrative staff have decreased by 50%. And so, we are committed to ensuring that Ontarians have the health care that they need, where and when they need it. I'd like to ask the member opposite, where exactly does the opposition party stand on this? As far as we know, the PCs have absolutely $0 for hospitals in their platform.
Thank you.